What is up, YouTube, guys and gals and non-binary pals? It's your boy, GigaBrain, first-year RadTech student, with a video on chest radiograph criteria. This video isn't going to be focused on positioning or patient history and patient interaction. It's going to be more focused on tech factors and image quality, the factors you can control to get a really good image, or in other words, perform a SLAY. If you follow my SLAY factor criteria, you can go ahead and diagnose yourself with having that dog in you, ensuring that you are in fact goated, and maybe the most important factor, would Yeet, a known radiograph connoisseur, Mr. Big Body himself, would he be proud of your work? Now, here are your tech factors. You want a 72-inch SID to reduce magnification of the chest. You're going to use somewhere between 110 to 125 kVp, depending on how thick your patient is. If they're ambulatory, you're going to put them up against the upright bucky. And if they have to stay on the stretcher, you just have to remember to position your image receptor either portrait or landscape, depending on their body habitus. And, like always, you want to make sure to collimate. Now, here are your SLAY factors for the PA chest. You want to demonstrate the lungs from the apices to the costophrenic angles. You want 9 to 10 ribs. You do this by giving breathing instructions. Take a deep breath in, hold it, and that's when you expose. You want to make sure your clavicles are below the apices of the lungs. You want to see an air-filled trachea, and you don't want a lot of motion. You want your patient to stay still, and the way you check that on your image is that the lines of the ribs should be sharp. You also don't want your patient rotated more to one side. The way you check that is the sternal ends of your clavicles, or the sternoclavicular joints. They should be equidistant from the spinous process. And you want collimation. You don't want your PA chest looking like an abdomen or an upper airway. This decreases patient exposure and gets us a better image. Here are your SLAY factors for the lateral chest. You want to perform a left lateral, first of all, to reduce magnification of the heart, get it closer to the image receptor. And you want to show the same anatomy. You want to show apices to costophrenic angles. Again, you don't want your patient rotated more to one side. The way you check that on the lateral is with these posterior ribs. You want them superimposed or no more than 2 fingers apart. You want to make sure your hilum is centered and that, again, you have good collimation. Alright, that's all I have for you guys with this video. If any seasoned rad techs stumble upon this video, feel free to give me any tips, any corrections if I made any mistakes, and if you know nothing about x-rays, leave any questions you have in the comments, and I'll try and answer them. I don't know which body part I'll do next, but I'll definitely be back with one of these videos. I appreciate you guys watching, and hope you enjoyed.